Okay, so hello everyone again. It's nice to have you today in our second webinar in IADS webinar months. I am Marim Al-Hadi, the Vice President of Science and Research in IADS. And it's very nice, like we will be having today our second webinar. And I consider to say like it's very special webinar since we have our speaker, Dr. Jonas. He's from Brazil. And hope one day to visit Brazil because I know how beautiful it is. So I will give the stage for Muhammad Ilyas. He is the General Secretary for the SCORE Committee in IADS and the webinar coordinator to moderate the session.
Hi everyone. So it's nice to have you with us today. I've waited patiently. Dr. Jonas lectures. So Dr. Jonas Rodrigues Silva, he's going to present orthodontics approach for the general dentist. He's a graduate at University Vale, faculty in dentistry, where he received his CDS in 2003, and he received his endodontic master in 2012 at the FUNORTE Barbacena. So since 2004, Dr. Jonas has been working on his own private practice, gaining to close to 90 years of practical experience. So it is safe to say he's more than a professional in his field. We look forward to his lecture. So Dr. Jonas, I'm going to give you the floor and you may start.
Okay. So thank you guys. Thank you for the introduction. Thank you, Mohammed. Thank you, Maria. Is this correct, your name, right? Maria. Maria.
Yeah, Maria. Maria.
Okay. Yes. So guys, thank you so much for the introduction. It's a pleasure. It's a very honor to be part of this program. So thank you all the students that have been attend for this program. So first of all, sorry about my English. It's not my main language, so sometimes it's a little bit different and difficult for me to explain exactly, but I try my best. So anytime you guys have some doubts or some questions about what I do, just send me the message, okay? Just send me a hi or something like this, and you can interrupt me anytime, okay? So, well, let's go. My presentation, the main topic is the orthodontic approach for general dentists, as you can see. So let's start to talk about this dilemma, because many of my colleagues as ortho, they usually apply for lectures for orthodontists, but I usually apply lectures for general dentists, for students. So that's why this main topic here, I think, will be very, very interesting for you guys. So this is a little bit about me. As Mohammed already said, I finished my graduation in Três Corações. It's a very, very small city here. So I did endodontics. I also did prosthodontics and last specialist and masters in orthodontics. So it's all my steps. I started from endo, and then I fell in love with the restoration itself. And also on the top of that, I started to work with some kind of adjustments in an occlusion, and then I did orthodontics. So there's a couple of years that I've been doing only ortho. So I came from Brazil, as you already know. It's a very, very different place. It's a very big place. There's a lot of different cultures. So I don't know if you already been here in Brazil. It's a very amazing place. I highly suggest you guys to come to visit us. There's beaches, there's samba. It's very famous about samba. So you're gonna enjoy, guys. Also the football, right? The football is very famous. So now I'm going to show you guys, first of all, my city. Just a little, very, very quick introduction. So this is my city. The name is São João del Rei. It's a very traditional, very old city. So this is one picture. We have these trains, very, very old train. It's a very, very calm city, a little bit, quite 100,000 people. So it's not that big. So there you go, guys. So let me look at my city. And let's talk about what we are here to talk, right? Guys, main question. I love to talk about ortho and especially in front of the audience or face to face with people, with the students, because there's many questions, especially from come from students. There's many questions. So, but it's very different the approach. So I started to ask you guys to not just thinking about just to straight the teeth, just to put them side by side. This is not enough. This is very very basic. I think we as a dentist and in this new area that we are living, I think we can improve ourselves with a different vision about it. So this vision, what I'm talking about, is something related with aesthetics. So this is a very, very famous doctor. Name is Dr. Sidney Kina. He's from Brazil. He's a worldwide known doctor. And he said that he usually talk about two objectives should be extensively pursued in dental students. Guys, just a quick question here. I've been receiving some sounds about the people who are getting into the class. Do you guys know a way to turn this sound off?
Doctor, you are a co-host. That's why you probably hear these sounds. We cannot really turn them off.
Okay, I'm sorry. I'm sorry to interrupt. Just because all and all these sounds, I'm quite confused about. My head is a little bit confused about it. Anyway, so I try my best, guys. Sorry to interrupt. So Sidney Kina usually say two objectives that should be extensively pursued in for dental for all our dentistry. So create teeth of natural proportions pleasing to themselves and to the other teeth, biologically integrated in harmony with the gum and tissue. So this is very, very important. And I've been applying all these two steps every single day in my daily basis. So also to produce harmonious and pleasant dental disposition with the lips and the outer structures of the face. So today we have this traditional thought. Maybe you, if you already come from background in dental, in your family and stuff like that, you're gonna see these traditional thought, and also for now the modern thought. So usually it comes from function, structure, and biological. So after that you have the aesthetics. Okay, so the modern we have a different approach. So we start from aesthetic. So all the aesthetics concept comes on the top of the function, the structure, and biological. But it's very important to say do not take the aesthetics only. You have to have your background in function, structure, and biological. But you need to start with the function. I have a professor. He usually say that the malocclusion, the problem with teeth, shows the problem, but the face and the aesthetics will tell you what to do, not that problem. You're gonna use that problem as a background, but the face and the aesthetics are gonna will be your main direction, right? So taking this as a concept, I have to start talking about goal duration. Sometimes it's a little, maybe for some of you, sounds a little bit not that interesting, but this is very interesting if you take for in a broad view. So from golden ratio, you have this Fibonacci sequence from Leonardo Fibonacci, which is a very famous old mathematicians on the past times. So the Fibonacci sequence is the sequence of numbers formed by the sum of each numeral with the preceding number, and so on and so forth. So you take a 0 plus 1 is 1, 1 plus 2 is 3, and so on and so forth. So this is the Fibonacci sequence, and then also you can apply for different aspects of your life. Here we have this golden rectangle. So this in this golden rectangle, we have this Fibonacci spiral. And with this Fibonacci spiral, we can take this golden number, which is 161 approximately. So from this golden ratio, you can apply this golden ratio in a lot of very old structures and beautiful extractions and instructions which have patterns that makes the beauty, makes the all the concept of what is good or not good, what is healthy or is not healthy, or is beautiful is not beautiful. So all of them starts from golden ratio. So if you take the measurements of, for example, from an iPhone or even the logo, you're gonna find the golden ratio. You're gonna find the golden ratio in a lot of very proportional structures. So even the body and the paintings, the arts, maybe you guys already know about it, but if you take this concept into the dentistry, you're gonna see all of these structures have this golden ratio, have this proportional. So this is our main focus. So we need to start from looking for the golden ratio pattern in our daily basis in dentistry. So this is a very interesting mask. It's developed for Stephen Marquardt. It's a maxillary surgeon developed the two masks. So these masks you can use for to fit if the space is proper, is adjusted in the golden ratio. So all of these measurements and these lines have the this proportional. It's very interesting. So in Brazil, we have a lot of dentists who also are eligible to work with facial harmonization. So they use Botox, fillers. I don't know in the rest of the world if the dentists over there can do, but here in Brazil, they are allowed can do. They can do a course and they start to work. And some of them, not all, but some of them are starting to talk about even these masks. I've been talking about this mask for a long time. I think 5 years ago, I've been talking about these masks and these measurements. And this is very interesting. This is very interesting, guys. So you can see, for example, Megan Fox is a very famous artist, and her face fits perfectly into the mask, as you can see. So also David Beckham, his face is very, very, very proper to the face, sorry, to the mask. Marilyn Monroe, and the one of the most famous one, which is perfectly, it's Angelina Jolie. So all the measurements are into the golden ratio. This is very interesting. Yeah. So, and on top of that, let's start to talk about more about these measurements, these concept, what is good or not good, or is perfect and is not perfect for dentistry. But before, please feel free to ask me if you guys have some doubts or some questions. Please call me. Just give me a message here, and then I can answer you guys. This is a very famous doctor from US, David Starver. I met him in 2011, I think, or 10, I don't know. So a long time ago. He's a very famous, and he works and he studies everything that I'm talking about. He works with the concept about golden ratio, the concept about these dental adjustments following this golden ratio pattern. So he says about he had this classification, okay? His classification about the macrostatic, mini-static, as you can see, guys. Let me here. Okay. So macrostatic, we have these three topics which we need to look for before to start treatment. If it's only a very, very tiny treatment, you don't need to focus on a lot of these steps that I'm going to talking about. But it's very interesting. I highly invited you guys to start to see the patient not only for the tooth itself, for the teeth disalignment. So I started to invite you to see the patient in a very different view. So smiling from side, from the face and stuff. Okay, so let's go. An equilibrium and facial harmony. So this is very important to know how's the harmony of the patient, if it's proportional or not. Facial type, we have this kind of facial type, and this is very important for those who are doing, for example, like I said, fillers and facial harmony. This is very interesting. Also, if you do a restoration, for example, veneers, you sometimes, I don't know if you guys already doing some veneers, but usually the lab, the technician, sometimes he asks to see the face. So the shape of the face similar to the shape of the teeth. So this is very nice. Labial volume is very important for the teeth, because depends of how much lip volume do we have, you're gonna have more teeth exposure or not. So this is very important. Of course, I can't change this with dental techniques, but also maybe I can suggest for some fillers and stuff like that. But anyway, just you guys know that there's the lip volume has a huge influence, and you're gonna see it later. So the mini aesthetics, which is reference diagram of dental aesthetics, upper lip line, like I said, exposure of upper incisors, and the incisal plan in relation to the lower lip. These two are very interesting. I'm going to show you. So first of all, the reference diagram of dental aesthetics. So this is very important to see in a broad view if all of them are nice, are proper, are adjusted, or if there's inclination different or not. So this is very good to see. This is like a broad view. Upper line, upper lip line. This is like we can sometimes you have friends, families that the smile is like big, you know, like the lip goes very higher, and you're gonna see sometimes the gum, or maybe sometimes you don't see the gum. So this influence a lot the result that you're trying to do. And also, I'm going to show you some examples of my patients that I did a treatment correcting these exposures. So exposure of upper incisor, like I said, usually what I mean in this article from Weber Ursi, he's a Brazilian doctor. He said that usually what is good or sexy, what is beautiful is 2 millimeters in when you have the mouth in the, I mean, how can I say, without smile, like in rest, you know. So a little bit, a slight opening your mouth, you're gonna see just a slight 2 millimeters. This is very aesthetic, like lipstick marketing. You know, you see some ladies in a lipstick marketing, you always see the lady with the lip a little bit open, and the little bit also an exposure of teeth, like 2 millimeters. So this is of importance. All of these topics, guys, are going to make sense later on. Okay. Okay. So number 4, incisional plan in relation to the lower lip. So this is very nice from Carlos Câmara. He's also from Brazil, this doctor. He's a very good doctor, by the way. He developed these classifications like a shallow plate and a deep plate and an inverted plate. So I invite you guys thinking about this. So maybe if you using braces for now, or if you already did old treatment, what I mean about old treatment is like a treatment with a technique that comes from old times. They usually do a shallow plate or inverted plate. So like a straight teeth. So there's a technique in ortho, the name is straight wire. So as in the name already saying, it's like straight wire. So you're gonna put all the teeth straight. So no difference, no adjustments, no lip influence, no mouth influence, and even a face and anything. So only straight the teeth, and that's it. That's fine. Move on, next patient. So that's the main reason that I've started to become a little bit uncomfortable with my results, because I only adjust the teeth, but I didn't see beauty on it. I just see the teeth straight, and it's not enough for me. And maybe because I came from Prosto, I started to thinking about more about aesthetics, and that's from that feeling, from that perspective, I started to work with aesthetics in orthodontics. You can see the Inciso plan, you can see this difference. So if you have this inclination, you know, have another inclination, which is not that aesthetic at all. And the microaesthetics, you have these few options. So you have dental format, contact points. This is very tiny, very specific subjects, but it's very, very nice to talking about. So dental format, like square or ovoid or triangular. So when you're applying for dental restoration or veneer or even ortho, you have to thinking about these situations. For example, when we have if I have a crowded teeth or very crowded, and the teeth are triangular, once you start to do the IPR, the interproximal reduction, you're gonna change the format of the teeth, and maybe that change is not that good. Maybe you're gonna close too much these embouchures. Maybe you're gonna decrease the proportional. So I will show you guys the contact point. The contact point determines the inciso and the gingival interdental embouchure. So the dental point is very important when you're doing some veneers, for example, because you can make the teeth more strong, or maybe the teeth more slightly delicate, all because of the embouchures and the contact points. Inciso interdental embouchure, like I said, is very important because maybe you already saw on Instagram some announcements of veneers and restorations, which is the teeth is all together, all aligned like a piano, you know. So this is not that aesthetic. This is not that good. You need to have these embouchures, but it's not that much. It's not just a feel. You need this understanding about aesthetics, which is best or not for your patient. Gingival interdental embouchure. Also, like I said, this is a black space. So sometimes you have this black space, sometimes you don't have this black space. For example, guys, just to show you on this third example here, you have this huge black space. This is a triangular teeth. So if you apply, for example, if you make these interproximal reduction between these two central incisors, okay, you will be able to reduce this black space, but also you can make the teeth slightly thinner, right? So this is not that good at all. You need to adjust in another aspect. I mean, as a spectrum of the teeth. So once I started to work, once I started to program my treatment, I always looking for these details. What I can do, what I have to do, what I'll be able to, which type of mechanics I will be able to apply to make this work. So harmony of a gingival margins, like a zenith, it's very, very nice and very aesthetic for patients who have the exposure, a little bit of exposure of the gum. So you have this relation, and this relation needs to be respected. You can use ortho to make it. Of course, you can extrude the teeth, you can intrude the teeth, but you need to focus. You need to focus to end up your treatment on offer better treatment for your patient with these zenith in the end. The midline is very important, not just the midline itself, but the inclination of the midline. Sometimes I receive some questions on Instagram asking about these kind of inclinations, these kind of corrections, about the midline, and is very, very important. You can make all the adjustments, all the details, but if you forget to correct the midline, not the position, not just the position itself, but the inclination. Sometimes the position, it's okay to skip a little bit because it's very difficult, and sometimes you can't, you're not able to move for the right or to the left. But the inclination is not allowed to keep it wrong. This is totally anesthetic. Axial inclination of the anterior teeth. This is important too, because once you have an inclination wrong, not just for the midline or for the whole teeth, but even for a tooth, if you have this inclination wrong, you're gonna make it. You won't have a very, very aesthetic treatment in the end. Mouth corridor is very common, and I've been seeing a lot of treatment with this mouth corridor in the end. And today we start to work in a treatment with more expansions. I don't know if you're already, guys, if you're already been doing ortho in your daily basis, or working with some ortho, or maybe doing some Invisalign and stuff like that. But once you start to focus on the expansion, all the treatment goes way easier, because it's like thinking. I invite you guys to thinking about, once you expand your upper jaw, your lower jaw adapts with the upper jaw very, very easy, and all because of this expansion. It's like if the upper jaw was locked somehow, you know. So expansion is very, very important for the whole development in the ortho, in your ortho treatment. And again, the golden proportional is very, very good. Of course, this is not a rule to follow strictly. It's the common, like in this phrase are saying in the end, the good sense must always prevail. So you need to have the good sense, guys. What I'm talking about from the first topic it's to here is just a broad view that I'm inviting you guys to use this broad view for patients. Maybe if you could take on some parallel concepts, as for example, on very good architecture. So first of all, before to draw or to develop a building or a house, they start to thinking about all the details about the terrain, the details about the structure itself, the details about the sky, the sun, and the wind. So I invite you guys to start to think outside the box. So thinking about these proportions and what is good or not good. Maybe you're gonna face something, oh my God, this is not good, and I don't know what to do. Okay, so take all these steps. Take the picture. Picture is the unbelievable tool that you need to use as a dentist, as a even ortho or any area. So take photo, take impression, and then start thinking about what you can do, what you can do to improve. Ortho is sometimes ortho is can solve all of these situations, or maybe tell you what to do if you have this concept. And I think this is my humble opinion, but I think with this lecture, with these topics that I said and that I'm going to keep talking about, you're gonna have this understanding. So keep going. The currently proportional between heights and width of the teeth. So again, this comes from the golden proportional, which represents for a central incisor around 80%. I don't know if you guys know how to make this math, but it's very easy. You just multiply the heights for the heights, and that's it. You're gonna have this proportional. So, for example, this is like, I mean, not that specific measurements, but you can use as a reference for central incisor 80%, 69% for a lateral, and the canines 72%. And for to sum up all these topics, all these details, Starver, he developed these table, these concept. This is very interesting, and then you can see. Then you have some measurements, some adjust what is good and not good, what is beautiful and it's not beautiful. You know, so this is like a concept. This is like the concept that I always see when I start a patient, when I have a patient, even a friend on the streets and parties or whatever. Every people that I look for, that I come up, I start to look the teeth, seeing these details, and also maybe if the patient is beautiful, there's her has she had beautiful hair, a beautiful skin, and I see like maybe the embouchure is not that good, the inclination is not that good, so it's slightly different, slightly detailed that patient needs to be amazing. Or maybe she's beautiful, the teeth are nice, the skin are nice, but the teeth are not that with these measurements. Maybe maybe she has bruxism, maybe she bite her nails or something like or stuff like that, and it's not that proportional. It won't be beautiful as could be. I hope I made me understand from you. So yeah, let's moving on. And again, what all of these have to do with ortho. Like I said, I said before, we need to use these techniques to thinking about how to make the treatment, the whole ortho treatment better. Okay, and now this is very, very nice because I don't know if you already guys heard about SAP. It's a very specific technique with ortho, and I've been applying this technique, and I'm going to show you. But before we move on, two things. If you guys have some questions, please make it. Don't worry about it, or maybe you can write to me, and I'll be more than happy to reply to answer you. And the first one that we are talking about, this is very like specific to the teeth, specific analysis, and sorry, not the teeth, but analysis overall. So there's teeth, there is facial, there's lips and stuff like that. And now I'm going to talking about a specific technique in ortho, but I'm going to just show you guys that what we can do with ortho to make the patient way better, way beautiful, the treatment way more engaged, and occlusion better also, you're gonna see. So STAP means smile arc protection. It's a type of bonding brackets. And let me explain. This sir is he's Tom Pitts. He's one of the most famous from US. He developed this concept, smile arc protection. He also developed the Damon technique. With Damon, Dwight Damon, his doctor. He's a doctor, and they were partners. So they split. Tom Pitts, he developed this technique, and now he has his own kind of bracket. So Dry Damon has these Damon system brackets, and Tom Pitts has his kind of brackets. Anyway, Tom Pitts developed this technique about smile arc protection, and I'm going to explain you what it is. Just a quick summary. It's a type of bonding technique to make this divergency and show and make the exposure of the teeth better, to make the lips and everything that I said before gonna make sense for you guys, and from taking this analysis. So what the people, what the word wants, it's like I mean, he usually say that these. He usually say this. He has this photo. He has this image into his article. So, for instance, if you see these, this is a very straight teeth, right? Like I said, the straight teeth, the lips okay, the everything's okay, but it's straight. So the concept of this smile arc is when you start the treatment, you like shift, you make the shift. Like you make these slight adjustments, and then you have more exposure to teeth. You need to practice. You need to see in the clinic in your daily basis to see how it works. And I'm going to show you some examples for you to understand. So here we have the Subbonding and the traditional bonding. So the Subbonding, I won't explain you here because it's very, very specific how to bond. But if you need some information about it, I usually teach this technique and some other techniques in my courses. But in summary, we have this traditional bonding and the Subbonding. The Subbonding have more exposure of the teeth. Sometimes I usually receive question about, oh, okay, but in the lower ones, tell me more about the condyles. Tell me more about the occlusion. You're gonna have a premature contact. No, not at all, because you're gonna adjust all the teeth, upper and lower, and especially you're gonna follow I mean, if you learn how to bond with this technique, you're gonna use the contact points as reference. So once you have these contact points as reference, even in the upper and the lower, you're gonna have the occlusion stable. So no premature contact, no pain, and all this is very good. Let me show you. For example, this lady, you're gonna see that the teeth are straight. She's my patient. In the end of the treatment, you're gonna see that the teeth are more exposure. I didn't make, maybe you guys can ask, okay, she did some veneer, she did some composite resin. No, not at all. These are her teeth. So this one is a Tom Pitts example in his hard article. You're gonna see this is like a shallow plate, right? This is like a shallow plate. The lip is not that heavy, I mean, to make it all the face beauty. But talking about the teeth and the smile, you see, this is a straight. And after the treatment, you're gonna see make it like a different alignment, a different exposure of the teeth. So more examples. This lady, you're gonna see she has no exposure of the teeth, just a tiny exposure, and she's smiling. She's forcing to smile. And almost in the end of the treatment, you're gonna see the teeth are more exposure. I didn't make any veneers. It's just an exposure. I mean, she did a veneer in the end, but here you can see she's using braces. This is aesthetic braces, but she's using braces. I just made that divergency that I told you. These also examples. This is a very one of the most I mean, big examples that I have. she was doing her treatment. This image was before she started with me. She was finishing in this phase actually. She said that she was finishing her treatment with these braces. She was ready to finish. So after a couple of months, I started. I changed the brackets. I changed the bonding method. You're gonna see. You see that the exposure is way more big and wider and extension and everything. So it's just very good. I don't say that, I'm not saying that you just need to do this, just the bonding. No, you need to follow the rules. You need to follow the adjustments. For example, in the taking the golden ratio, taking the that concept that I told you also in consideration. And let's talk about now orthodontic resources for aesthetic finalizations. So, for example, let's talk about this lady. She has some things to change. She's beautiful, okay, nice hair, everything's okay. But if you see, you're gonna notice that she has her upper jaw is a little bit constricted. You see the mouth corridor. Also, you can see the canine 13 is more it's more outside the alignment. And from my view, this is not that exactly. This is not that perfect symmetry. So we started the treatment. Okay, we took into consideration all the details that we are talking about. But here, the most interesting parts of this treatment is that she lost her center incisor. Her center incisor, I think, is 11. Let's see. Hold on. Yeah, she had resorption, as you can see. So we need to extract. And with ortho, I don't know if you guys know, but if you make the an extrusion with a lower force of extrusion, the bone are gonna follow these movement. So in other words, you can make the bone maybe more downward, maybe more upward, so you can make this difference. Okay, so I started to extrude this root. So I take the tooth, which is that has a resorption. So I take the tooth, I started to extrude a little bit, very, with very small force, and all the bone, all the tissue started to follow. So these crisps here, this bone crisp here, follow. So she didn't lost her bone crisp. Okay, so again, sorry about my English. I hope that you guys are understanding this concept. So again, slow extrusion always. If you make it a very strong extrusion, you just make it a function, or you're gonna extrude the teeth, and the bone is gonna stay up there. So after this extrusion, okay, we develop these veneers with the the correct proportion, okay, with golden ratios. So also with the teeth, you can see in the end, we did the implants. Sorry about the pictures. I don't have the previous one because I lost the pictures. I'm sorry about that, but then here you can see it's a little bit dark in the at the gum. So you see that the gum is nice, that the black space, that the bone crease is okay. Why? Because I extrude the teeth very slowly. What I'm saying here is show you guys that with ortho we can do all of these treatments. You can expand, you can make the teeth more wider, more beautiful for the face, more engaged for this face. So this is the beginning and this is the end. So you can see I made this difference, I made these adjustments, and you don't notice that she has implants. So another case that, as you can see here, she doesn't show a lot of her teeth. Also, she has a mouth corridor because, as you can see here, she doesn't have the levels. I mean, she already did a treatment. As you can see, you can notice, guys, that she has a retainer. That's okay. That's fine. She did this treatment. The doctor couldn't close all the gaps, of course, because are missing two teeth in the upper jaw. But she wasn't satisfied. She wasn't okay with this treatment, and I suggested her to open the space for these missed laterals, for on the left and the right. At the beginning, she was, oh no, it's not possible. They told me that it's not possible. I said, no, it's possible. It's highly possible. Don't worry, we can do it. And on top of that, we did the implant and then the veneers, and let me show you. So I did the bonding following that analysis with this Myoac protection. I did all the analysis of the teeth, which, for example, guys, you can notice that on the 12, you can see the bracket is more close to the gum compared to the not 12, sorry, the 13, because she doesn't have the 12. So on the 13, you see that the bracket is more close to the gum compared to the 23. So all of these bone details we need to follow in with ortho. And I use the mini screw for this treatment because I need to make the retraction. I use these IZC mini screws, the infrazygomatic. We use the infrazygomatic technique. So we place the mini screw aligned to the rest of the teeth, and we start the retraction. So I started the retraction. I placed the alignment, the brackets, and the wire, and I did the retraction. All the system was working together, making all the teeth aligned, making all the proportionals. Sorry. And then we applied for the implants, as you can see here. So here she was the 10 points, and then with the implants ready to be placed. Okay, she did the surgery, placed the implant. The bone is okay, it's very healthy. As you can see, I did the preparation for the veneers. I took the impression. And there you go, the impression and the teeth. So maybe you guys can ask, oh, Jonas, the midline is not that aligned. Okay, I know, but I mean, it's not that big because, like I said, it's okay. Sometimes you have some difference because it's like acceptable. Why acceptable? Because for me, the rule is the proportional. So sometimes the proportional is it's okay, and for you to adjust the midline, you're gonna reduce the proportional. For maybe on the right side, they're gonna be lower than on the left side. Anyway, this didn't make any difference at all. And you're gonna see this is the result in the end. So you notice that the center incisor is more wider, is big, is more proportional with the teeth. So all these measurements, all this proportional, isn't me that I do I mean, doing some calculations. I just took the photos, I just take the impressions and sent to the lab. And I suggest you guys, I'm gonna finish the presentation talking about it, but I suggest you guys to have a technician partners that you can work, then you can discuss what is best for your patient. So this is the last case I'm going to show you guys. It's a very interesting case, and this case is very, very nice because it's all about golden ratio. It's all about golden ratio. You're gonna see. So he had these kind of teeth. This is very small teeth. She was beautiful. Okay, I can see it. It's okay, but the teeth is not that good. Also, she doesn't have the 31, as you can see. So I bond the brackets. This is a Damon brackets. And then we start to use these coil springs, as you can. I don't know if you guys can see on the bottom image on the bottom. There is a coil spring. Open the gaps. Why open the gaps? Because the proportion is not that good. The occlusion, even from 15 to 25, is not in proportional. So I started to open to expand the arch, and of course, even the lower than we did the implant and the upper, sorry, in the lower one. So I started to open these gaps, and once the gaps are opened, she was very, very mad with me, but it's okay, I understand, and she trusts me, so that's fine. And also she did gingivectomy. Because the proportion is not that good. So we simulated the gingivectomy, and she did the gingivectomy. So this is right after the gingivectomy. You can see the teeth, I mean, the face, the concept of the teeth already changes. So then I took the impression, I did the preps, removed the old restorations. And from this image, you have this between the treatment without the restorations, the old ones, and then we have the treatment ready. So in my opinion, my humble opinion, I have a more proportional teeth. I have the teeth which is more wider. It's more not only about the color, the lipstick, and the hair and everything. Thinking about the concept only about the size and the measurements of the teeth. That's my purpose here, to show you, to make you guys thinking about outside the box and to see what you can use, how you can use these golden ratios concepts with aesthetics with ortho, besides, or I mean, side by side. A pleasant smile can produce an aura that enlarges the beauty of the face, being part of the qualities and the virtues of the human personality. So this is very powerful. And this is the main concept that I've been talking with my patients. Maybe, I mean, not maybe, but also making them believing on me and then accepting the treatment. So also I can use these features, these acknowledgements as a tool to sell my treatments, to promote better quality for my patients. This is very nice too. So which tools I've been using for ortho? So I use these two brackets. This is one bracket. This is a kind of bracket, self-ligating brackets. This is a very specific bracket. This bracket itself is from Tom Pettis. It's not the demo, but I've been using all the time on 100% of the time self-ligating brackets, and also Invisalign. For aesthetic, I've been using these kind of impression tools, and also this scanner that I have, this standard 2, is very nice, very good. It's very cheap, actually. I mean, compared to the other ones, it's very good. And for my results, for my treatments in aesthetic as a pro, so I've been using Clearfield, also single bonds, and these kits for my aesthetics instrumentations. This is very, very good. So my results are going more than 10 years and all good so far. So just to finish, guys, communication. What I'm talking about communication. To have the success, you need to have the communication, a very good communication with your lab, like I told you, respect to the patients and the trust. So these all together. So you're making them the communication, of course, the communication of course fits to the patient, but just these images are showing you guys to have the success, you need to have the communication. So start please to thinking about more broad, more wide, and looking for partners that have the same concept. Maybe I mean, I'm not maybe, but I mean, I'm sure that you're gonna reach better, longer places in your dental journey with better communication and partners. And the last, photography. Photography for me, it's game changing. I don't know if you guys have some features for photography. Maybe you guys have been using your phones, Galaxy or iPhone, whatever, Xiaomi phones. Anyway, I have my phone, but I've been using on my daily basis on my clinic just these professional cameras. So macro lens, Canon camera, studio flashes, make them different. So not just to promote my work, but also to study, also to present to the patient. It's more natural if you adjust the light, if you know how to adjust the white balance. So it's very interesting. So, my friends, my dear friends, everybody's a genius, but if you judge a fish by its ability to climb a tree, you believe your whole life believing that it's stupid. So thank you so much. It was an amazing time with you. I hope to make a little bit difference in your life from now on. And I'll be 100% available on Instagram or even on my email. So call me anytime. Thank you, guys.
Thank you, Dr. Jonas. It was amazing presentation. So, I will open the question line for people if they have any questions. So they could ask you. Do you guys have any questions on the subject on Dr. Jonas' lectures?
Sorry, again?
I'm talking to the attendees if they have any questions for you.
Okay.
Thank you so much, Dr. Jonas. Me personally, like a general dentist, I really enjoyed it. So thank you so much for clarifying your every point in very clear way and for making it very simple for students to understand. So thank you so much.
Okay. Thank you for your words.
Thank you.
All right, we have a question from Samir. I have a question. Can you guide about space maintainer for pediatric patient?
Can you guide about? Oh, okay. Yes, for pediatric patients. So there's some difference between the space maintainer. I don't know exactly which kind of maintainer that you're talking about, but usually what I've been applying for my patients when I need is like I bond the like a ring in the patient, for example, on the molar, and with this very small, I mean, wire in the distal area of the other teeth. So this is the retainer that for space that I've been using. Also, sometimes I use a removable appliance with the tooth in this space, and then I'm going to remove the excess of the teeth while the permanent are come. I'm not sure if I respond your question, but the retainer for missed teeth in pediatric is very, very easy. Just if you have a very good lab, you can ask them which is best for that case. For this case, it's very, 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 very simple, to be honest. You won't have problem to find a way to do it. There's a question here about I want to ask about between. Let's see. Okay, so talking about Arut Ahmed, saying that asking about the bad alignment between the nose and the center incisor, right? So I understand, as I'm understanding your question, maybe the patient has these difference between, for example, the eye or the eyebrow or the nose, maybe this difference in the face. So I usually take like a floss and I put from the chin to the top of the head. So in this line that I make, this is my my midline. I'm not only take the nose, the chin, the teeth, the lip. I just take the whole concept of the face. So not just the nose. I understand what you're asking, but in this case, it's more broad. I don't know. I mean, I'm not seeing the face, but in these cases, you're gonna see the whole concept of the face, and then you can adjust a little bit from the right, a little bit from the to the left. But like I said, the angulation of this midline needs to be adjusted. For maybe, for example, the patient has some difference in the eyes, so we're not going to use these the line from eye to eye. You're going to use for on the mouth, or maybe ear to ear. You're going to see the wide vision of the face to adjust, to have this occlusion inclination of the midline. I hope again to make it clear. Sorry.
We have another question from Samir. As it stated, semen space are not really appropriate, so tools should be moved in those space and contact points should be fused. Which thing are force preventing from movement in this space?
Oh. So sorry, I didn't understand exactly. Points. Oh, so let me see if I understood correctly. So you're asking about, like, for example, when I mean I pulled the teeth back, and what I did, I mean, what I use it to prevent them to come back and to relapse to make all them disaligned again. I think he asked me about it. I don't know. So tell me if I'm wrong, Mohammed. Is something like this?
Yes, I guess so. Can you please formulate your question better, Samir, if possible?
Yeah.
Guys,
Anyway,
I'm gonna share the form for everybody, the feedback form. Please fill it to get your certificate.
Okay. So just to sum up regarding this question about Samir, just to understand, this concept is very nice, and I've been talking about for into my specialist program here in Brazil. But just a very quick recap about it. If you have maybe this is like from construction. If you take the train goes into the tunnel, you see in the beginning of this tunnel there's a lot of rocks, one on top of the another, making the tunnel curve. I don't know if you understand me, but every rock making this curve are making the tunnel able to not come down or to destroy itself. So for the teeth, for the alignment, it's the same concept. Once you have the teeth all together, side by side, contact point to contact point, in all alignment, the force I'm gonna contact for in each of these contacts are gonna create the force and the structure to maintain as it is. So I've been using these examples of the bricks all together. This is because this is a very basic concept of engineering. For mechanics and constructors. So the concept is the same of the two for ortho treatment. Again, I don't know if I made me clear, but I think it was what about Samir asked. Did you guys understood what I said?
Yes, we did.
Lovely. Okay. So Mohammed, I'm gonna fill it up with this form that you.
No, the form is just for the attendees.
Oh, I'm
yes.
sorry.
No worries about it. You were great, by the way. So I guess, guys, if you don't have any question, we're gonna let our doctor go on with his day. He's got a special day today. They have the Catholic feast, right? So
Yeah.
It was a pleasure to have you with us, and thank you for all the effort. We could feel so much effort in your lectures. So we appreciate you very much for it, and thank you for being with us today.
Thank you, guys. Thank you so much. Thank you all. Mohammed, Marian, thank you. Thank you so much, guys. I hope to meet you in person, you guys, one day.
We hope to.
Yeah.